Hello and welcome to ID Talk, Answers from Infectious Disease Experts. I'm Dr. Nathan Price, a pediatric infectious diseases specialist at Banner University Medical Center, Tucson, and associate professor of pediatrics at the University of Arizona College of Medicine. With Dr. Scott Olson, I am the Arizona AAP Infectious Disease and Immunization Co-Medical Director. This podcast has been created to answer questions from our chapter members about anything and everything infectious disease and immunization related. Thank you for tuning in today. This is the week of December 2nd. So let's get to our first question. As of November 2024, a total of 277 measles cases have been reported in the U.S. Do you predict we will see a rise in cases in Arizona? Excellent question, and the bad news is that since this was asked, an additional 3 cases have been reported here in the United States, and 6 of those total cases have happened here in Arizona. So if you're ever bored, I highly recommend that you look at the Journal of Infectious Diseases paper published in 2011 about our 2008 outbreak of measles here in the Tucson area. The thing about measles is that it's incredibly contagious and has about a 90% attack rate in non-immune individuals. And this is because measles is transmitted by the airborne route. So you have the droplet nuclei that can stay suspended in air for prolonged periods of time and travel prolonged distances. In the 2008 outbreak, there were many patients who had measles that had no known direct contact with anybody with the measles. And that's because, again, these infectious particles can move far distances. One of the cases, the person who got the measles walked into a hospital where somebody was hospitalized with measles, so there wasn't any other known close contact. Other people were just in the same waiting room across the entire waiting room and didn't have any direct contact. And one person was in the ER in a different area of the ER and got the measles. The good news is that our vaccines really work quite well at preventing the measles. The first dose has a 93% efficacy rate, and the second dose increases that rate to 97%. As ID doctors, we like to harp on the fact that that second dose isn't a booster. It's really meant to catch that group of people that didn't respond that first time around. Unfortunately, there are a lot of people choosing not to vaccinate, and Arizona is number 5 in the nation for our vaccine exemption rate. We allow exemptions for medical reasons, religious reasons, and personal belief. And unfortunately, the place where this tends to get enforced is at the school level. And so if people are being homeschooled, then they often can avoid the question entirely of whether or not their child has been vaccinated. When we're trying to prevent measles in the community, you really need a 95% vaccine coverage rate to prevent those outbreaks. Unfortunately, this last year, Arizona kindergartners only had an 89.3 coverage rate for measles, and that's down from the year before, in which we had an 89.9% coverage rate. So, in answer to that first question, do we think that we'll see more measles? I think yes. I think it's only a matter of time before we see that because we have this low vaccination rate here in our communities. So keep your eye out for the 3 C's, cough, coryza, conjunctivitis. So children who have the measles often have a high fever and a brassy cough. We've probably all heard about the Koplik spots that are in the mouth, but those tend to resolve by the time they are symptomatic. The rash tends to start at the head and then moves to the rest of the body. And early in the course, the rash may be similar to other rashes. And it's not till later we tend to see this coalescence that looks like the classic measles that a lot of us have seen only in pictures. So if you suspect that somebody has the measles, you should really work to isolate them as soon as possible. The first thing you can do is stick a simple mask on the patient. That should go a long way to preventing this transmission of these droplet nuclei. If you have a negative pressure room, you should use it. If you don't, then you can do everything you can to try to limit exposure to other people. Don't have them in the waiting room. If you know they're coming in for this specific purpose, depending on the situation, they may not need to come at all, or you can meet them at the door, put the mask on, and bring them into, again, as isolated a room as possible. So that's enough about measles. Let's look at question number 2. Is remdesivir safe in children hospitalized with COVID-19? This is another great question because COVID-19 isn't going away. And again, the good news is that children tend not to do as poorly compared to adults, but our children still get sick with COVID-19. Right now, in our institution, we have a handful of children that are hospitalized with COVID-19, and we even have children in the ICU because of it. So it's still a problem out there, and there's still things we need to do. So we know that vaccination is beneficial when it comes to preventing COVID. It can prevent all disease in some lucky patients, but the real benefit comes from preventing severe disease and death. Once the infection has established itself in the patient, we really don't have a lot in our toolkit to fight it in the sense of antivirals. So remdesivir is an adenosine nucleotide prodrug that inhibits the SARS-CoV-2 RNA polymerase, and it does this by acting as a chain terminator in viral replication. It's only available in IV formulation, so that limits the situations in which we can give it. There aren't a lot of data with regards to safety and efficacy of remdesivir in kids. So the early clinical trial where they looked at efficacy and safety involved almost all adults, but there were 8 children ages 12 to 18 years of age. There's a more recent open-label clinical trial involving 53 children, and this was a phase 2-3 study that included children of all ages. And then there have been multiple retrospective case series from various places in the world that have included children of all ages, usually 10 to 50 participants at a time, and mostly are focused on things like safety, but a little bit of discussion of efficacy. When we look at safety, most of the data is in adult studies, and the adult studies show that there is a risk of elevated LFTs, elevated creatinine, and potential for bradycardia. The pediatric studies have mentioned these things as well, but they tend to be pretty rare, and fortunately they're not usually clinically significant. So the pediatric studies tend to conclude that remdesivir is well tolerated and safe in children. Now, efficacy is a different matter. Like I mentioned, there aren't a lot of data. In adults, there seems to be a modest benefit of using remdesivir in certain clinical situations. In children, they just haven't done the studies to be able to know that. And so while it seems to be well tolerated, we just don't know, is it beneficial or not. We don't have anything that says that it wouldn't, but again, we don't have anything definitive to say that it will be beneficial. The Infectious Diseases Society of America has guidelines for the diagnosis and treatment of COVID-19, and they work really hard to keep it up to date. So I recommend that if you are trying to decide what treatments need to be used for children, that you take a look at it, and then you can use that information to help you decide what works best for your patient. Again, knowing that data for children are scarce at this point in time. So let's move on to question 3. The submitter asks, I often recommend saline nasal washes to my patients when needing sinus relief. Can you review best practices for saline nasal washes? Another great question. Saline nasal washes have been around for a while, and people use them to try to relieve various nasal and sinus conditions. There is data suggesting benefit with acute and chronic rhinosinusitis. And some studies show that this may help improve symptoms, and it may decrease the use of antibiotics, which is always a good thing for our patients. Most of the data is using saline solution rather than just water. And the theory is that the saline washes can improve mucociliary flow, can liquefy thick secretions, can soothe the irritated tissues, and may decrease forceful blowing. Of course, this can all be undone if your patient doesn't tolerate it and is screaming and crying, which can increase your secretions and may increase inflammation. And the thought is that regular water may increase irritation as well. There are different ways of administering the saline washes. You can do low volume, low pressure administration like nasal sprays. You can do high volume, low pressure like bulbs and neti pots. And you can do high volume, high pressure like syringes and pumps. Many experts prefer the high volume administration methods. How you position the patient's head may affect optimal administration. For the high volume irrigation, head down and forward may be the best way, and for the low volume administration, pointing the nose towards the ceiling may be the best way to do it. There isn't any definitive data to recommend one specific type of saline solution. There are options for hypertonic or isotonic solutions, also with buffering and other additives, but at this point in time, there's no one definitive thing to use. If you're doing nasal washes, you really need to pay attention to safety, especially with regards to infection, because even if you clean the equipment regularly, there's a high rate of bacterial contamination with bacteria like Staph aureus and Pseudomonas. That being said, if you follow the cleaning instructions, it's unclear if there is any clinical significance to these bacterial organisms being present. There are different ways to clean the equipment, and I would recommend following the manufacturer's recommendations. But options include soap and water, and sometimes even boiling and microwaving certain types of equipment depending on the situation. The saline used can either be bought pre-made or it can be made at home. You really need to be careful though with what water source you're using if you're going to make your own saline solution. The safest water source is distilled water or sterile water that you can buy at the store. Unboiled tap water is not recommended because you can get infection from that water. There have been cases of acanthamoeba and fatal Naegleria, and even fly larvae getting in the nose and sinuses from people using things like neti pots using tap water that hasn't been boiled. So the current recommendation is if you're going to use tap water, that you boil it for 1 to 3 minutes depending on your elevation, and of course waiting for it to cool back down before administering it. The CDC has a really nice infographic for patients on this that I think is worth taking a look at. All right, let's move on to our final question. Now that we are in respiratory virus season, what supplements or practices are recommended to help keep children's immune systems high, other than vaccines? Another excellent question, and as usual, there isn't a quick, easy solution. So most of the things we can do right now are the usual common sense things that require daily effort. So things like making sure you eat right, exercise, and get enough sleep. So let's look at diet first. What we eat can certainly affect our immune system. So we know that diets that are high in saturated fats, trans fats, and added sugars can promote chronic inflammatory responses in the body that may decrease our ability to fight infection. On the other hand, fruits and vegetables, whole grains, lean proteins, and healthy fats can all promote wellness and decrease the risk of infection. And we all know that getting a good night's sleep is important for our health, but I think we often forget that it can certainly affect our immune system. So there have been studies that have shown that even missing an hour or two of sleep can decrease our immune system functioning. It can do things like decrease our NK cell function, it can decrease our antibody response after vaccines, and it can increase our risk of getting upper respiratory infections. When it comes to exercise, it's what we call a J-shaped curve. On the one hand, if you're sedentary, you have an increased risk of infection, and on the other hand, if you exercise too much, you may have an increased risk of infection, although that effect may be transient. But right in between, moderate exercise is beneficial to our immune system. That moderate exercise can increase immune surveillance and decrease chronic inflammation. On the other hand, they did a study looking at runners who had just run a marathon and compared them to controls, and they found that heavy exertion was associated with a higher risk of upper respiratory infection in the week or two after that heavy exertion compared to the controls. So long story short, don't be sedentary and don't overdo it. And of course, as usual, when you turn around, it seems like there's always one other thing that you can buy to try to supplement your immune system. And this is a really difficult question to answer. We know that micronutrient deficiency can certainly increase your risk of infection, including severe infection, depending on the situation. But it's really unclear whether supplementation outside of deficiency makes a difference one way or another. You can find articles supporting supplementation, and you can find articles refuting supplementation for pretty much every option that's out there. And of course, there are a lot of options. You have vitamins like vitamins A and D and C, to name a few. You have minerals like selenium and zinc. There are botanicals like echinacea and garlic and andrographis, and of course a whole host of probiotics. When you look at the data that's out there, there's no definitive proven benefit to any one of these supplements. On the other hand, there is a potential benefit depending on the situation, and fortunately there's little risk of harm if you use them appropriately. The National Institutes of Health has a really nice fact sheet for healthcare professionals about dietary supplements for immune function and infectious diseases, and I highly recommend that you take a look at it because it really goes over the different data that's out there, the different risks, and the potential benefits. And so you can take a look and decide, is this the right thing for you and your patient? Well, that about does it for this episode of ID Talk. Thank you again for listening. The Arizona AAP members can submit questions for future episodes to id@azaap.org. The Arizona AAP would like to acknowledge the generous support of the podcast by the Arizona Department of Health Services through the Title V Maternal and Child Health Services Block Grant funding. For more information and resources related to infectious disease and immunizations in Arizona, or to become a member, please visit azaap.org. Thank you for all that you do, and we'll see you next time at the next ID Talk podcast.